The experts, however, say the SARS-CoV-2 virus seems to have a life of its own and is yet to be fully understood. So what have the experts in Ghana come to know about how the disease affects the human body? Joining us to help us with some insights is Dr. Samuel Akoriyea, Director of Institutional Care Division at the Ghana Health Service, who is a leading member of Ghana's COVID-19 case management team. And Dr. Samuel recently coordinated autopsies on some persons who died of COVID-19 and will also share with us what they've come to know. Welcome, Dr. Samuel. And let's first start with this story that's coming from Tamale, where this family is saying that the body was handed over to them. Of course, the hospital authorities have responded and they're saying no, they were also involved, they were deeply involved in it. But how do you handle a situation where we would have to do some contact tracing as a result of the exposure?
All right, thank you so very much, Israel. First of all, let me say this. I don't like talking about COVID without saying a hi to all the gallant health workers who are frontliners, all those working in the hospitals. I call every health worker a frontliner because in the middle of the war, everybody will have his role to play. So hi to all of them, and they should keep it up. And also, you see that I'm by myself. That's why I don't have my mask on, but when I get to the point where I have to put it on, I'll put it on, make some little explanations. Now, let me say this about that. One of the things I've been talking of, and I introduced this term with a couple of friends some days ago, is about community ownership of COVID-19. And what do I mean by that? Community engagement, community education, but ownership. They should own it and help us. Because what we've seen with this case is pure communication gap. And I know very well that the regional director is a very capable person. I've spoken with him, I've spoken with his deputies, and we have strict protocols. Those protocols were adhered to, and they will address it definitely with better engagement, where the people will be, once we calm them down and we explain and explain, they will surely understand. But I want everyone to know that we have strict protocol when it comes to burial. And we only don't do it alone. We even collaborate with the environmental personnel from local government. And so there are things that we can corroborate, that we have burial teams, we get them trained, and they do what they're supposed to do when it comes to burial. We just don't give it to family members that go bury. But we want that community ownership, and we'll get this solved. So,
Dr. Kaba, the point you're making essentially is that burial teams handle COVID-19 deaths?
Absolutely, yes. Burial teams handle COVID-19 deaths.
All right.
And they are well trained from environmental.
All right, let's move on to Ghana's case count right now. I know you've shared some thoughts about Ghana's COVID-19 case count some weeks back. Are you surprised that we're approaching 6,000 now?
Oh, not at all. Not at all. The point about it is that the more you test, the more cases you will get. And the less the public adhere to the prescribed measures that we've put in place, the more cases you will get, because then people keep transmitting, especially in the case where we have a lot of people asymptomatic, and we have a lot of people that this has not yet sunk into their brains, that look, we are dealing with something real. If you are on the ground, you see in the markets, you see in some sports what is happening. People just don't believe that it's happening because it's not sunk in their minds. And that is why I talk about the community ownership of this, community involvement. Because or else the figures will keep rising.
All right. The health minister on Thursday said Ghanaians should come to terms with the fact that the virus will be with us for a long time. Is that of concern to you, especially because the WHO has said so?
All right, Israel, let me say this. It's not only a concern to me, it's a big worry to me. Because WHO 3 days ago on Wednesday conference, somebody asked a question. Are we somewhere near a vaccine for this virus? And the answer was categorical, that for now, we still have some couple of years to go with it. Normally, vaccines would take about 10 years, a decade, 8 to 12 years to develop. Now, what is happening is that they're trying to work on this for at least by next year. But we also know what it entails. So, what they said is that we should be ready to handle this like any other disease, because at the end of the day, it is going to be with us for a while before we find it. Because there are only 3 ways of getting this thing done. And whenever WHO says something, it's talking for a lot of countries, all member countries, and there are recommendations. So every country got to take that and localize it and tailor it to its own situation, its context. And then this is our context, and this is why I say I'm worried. And I want you to listen, and everybody listening very carefully.
All right.
There are 3 things to do here. The one is that we get the vaccine. The second thing will be that if we don't get the vaccine, then we'll get into herd immunity, which means that about 50 to 70% of people got to be infected before we can say that we have herd. No country wants to do that because it's not a smart thing to do. A lot of people will die. The third thing which countries have done, and they've been a little successful, has been to extreme these measures where government does its part, contact tracing, testing, isolation, treatment, and then the people also do their part, which is the social, the community ownership. In our case, if we take this, right, we start to look at it, we need to look at it from 2 places. One is about the sub-region. Just as I was walking here, I was looking into our friends in Togo. They have like, they got their first case on the 6th of March. Burkina got his case on the 9th. Ivory Coast on the 11th of March. They recorded their cases before Ghana. And Togo is still 238 thereabout. It means, one, either they are doing something so good, or 2, they are not testing as much as we are testing. Should we lift any sanctions and we go back to this ECOWAS deal, it means that anyone can still come into Ghana, and just with 1 case we'll be in a mess. The second thing is that if we look at it from our own internal issues, is that at this particular moment, Ghana, we are now experiencing this, walking into the regions, spreading into the regions, and this is what would happen. We are walking into rainy season straight away. During that rainy season, that's where a lot of people will be having flu. During that rainy season is famine. And then we have, in our regions, our health system is not as robust as in the capital or in Kumasi. Again, the youth in the regions, you and I do understand this, that in Ghana, most of the young ones in the regions, they move towards the capitals for greener pasture. So what is happening is that the elderly are more in the regions, or I would say, and they are the farmers. When it strikes them, we don't know what will happen. And imagine a farmer is not going to get up early in the morning and say, look, I have a sore throat or I have a cough, so I'm not going to farm. And we know that people farm in groups, in clusters. And that is a big, big worry, because then when it hits the region, it will overwhelm our health system. And remember, quite recently, our president said we have 88 districts with our hospitals. If we get cases in those places, what happens? We are identifying this. We are working on that, but we just want people to know so that they cooperate.
So, Dr. Kaba, you've said quite a bit.
Yeah.
What are you saying we should do? Are we to begin mass testing? What should we do?
Israel, we've also learned so many things when it comes to mass testing. You know, with our partial lockdown, this is my personal lessons I got from it. You do not go into mass testing without a good testing capacity. And let me define what a good testing capacity means to me. Is that, one, you should have all the resources, the logistics to do the testing. But 2, it also means that you should be able to turn out the results within 24 hours or 48 hours. If not, what happens is that if you turn results out after 1 week, after 2 weeks, or after 1 month, what use will they be? So we need to prepare ourselves for that. But we can avoid the mass testing if we go into that place where the community owns this, and then we all abide by the use of the masks, the hand washing, and the sanitizer. Give me 1 second, let me say something. These days we all talk about the masks, right? But get it right. The use of masks does not substitute hand washing. Neither does it substitute sanitizers or social distance. It complements them. And neither is it for you to put it on and when you're going to talk to me, you remove it, because the virus is smart. When it gets into you, what it makes you want to cough. And when you cough, it goes to the next person. And that is why we say use the mask. So, and not to be touching it every second. So when we understand all this, I think we'll be able to progress better.
All right, Doc, you talk about the fact that we should be prepared to do a lot more testing, churn out tests a lot faster, but we have boosted our testing capacity in the last few weeks. We should be able to do this, shouldn't we?
Yeah, the fact that you should be, look, Israel, you know, whenever I listen to people talk about a positive case, there is something strong that comes into my mind as someone on the ground, and is this. When Ghana has one more case today, or two, it means to me we need to find 2 more beds. We need to get food to feed someone for the next 18 days, right? It means to me we need to find more medicine for that person. It means we need to get more contact tracers. It means we need to get more suits, coveralls. It means we need more human resource, and it means that health workers stand a chance of being infected. So yes, we've boosted our testing capacity. Now we have about 9 places that can test. We have, I can mention them to you if you want. We have 2 in Tamale. We have 1 in Kumasi. We have veterinary services here, CSIR, Noguchi. We have Takoradi. We have Kolebu. And so we have Volta region. So we've boosted it, but it's not enough. Right. We need to do more.
Doc, I have one final question I need to ask you before we end this interview.
Yeah.
We know some autopsies have been performed on COVID bodies. Do you have the results, and how relevant is that to Ghana's case management?
All right, so I'm not going to give you details. The details will come out later, but I can just give a gist. Yes, we did, and it was something very good to have been done. And I thank the pathologists who did this, and I thank the minister for the leadership in this, and the director general, and all those who cooperated, and all the pathologists in the country. We found out something very interesting, and the one is that...
And what did you find out?
One is that people actually die of COVID-19, but also people don't die of COVID-19 just like that. Some die because of the comorbidity. So what it means is that if we get a case, for instance, you are diabetic or hypertensive or a chronic smoker, and you come with COVID-19, there are 2 things that can happen here. One is either the COVID is actually consuming you up, or 2 is because you've actually decompensated with your original disease. And we found out that the original disease, if we treat it aggressively, you stand a chance of what? Surviving. And because of that, it has helped us, together with international literature. Of course, 2 or 4 cases is not enough to make a drastic change, but at least it's a data that talks to us, and that is the language of the deaf. That's the silent language of the deaf, that look, this happened to me, don't let it happen to the next. So we've improved our case management by adding anticoagulants to it, because we noticed that most of the they say the disease had some kind of microthrombosis that I don't like being very technical when I'm talking to the people. I like to be very, like they had some clots somewhere in the lungs that we need to use some tablets to really get them dissolved, or some medicine to get them dissolved, not necessarily tablets. We need to put some things in places, and we treat aggressively their original disease. And with that, more people will be surviving. And with that, Ghana is contributing to the literature, is sharing experience to the sub-region and to the world. And we hope that it will help improve the management of cases with COVID-19.